Good morning, everyone, and welcome to historic Convocation Hall. My name is Merrick Gertler, and it is my great privilege to serve as the 16th President of the University of Toronto. I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. I am so pleased to open this morning's proceedings on behalf of the University of Toronto, our Dalla Lana School of Public Health, and the North American Observatory on Health Systems and Policies, together with our partners, the Broadbent Institute, the Wellesley Institute, and Women's College Hospital. Let me begin by thanking our talented student musicians from the Faculty of Music who were entertaining us earlier this morning. I am delighted to welcome Senator Bernie Sanders to the University of Toronto. Senator Sanders has been a powerful and outspoken champion of equitable, accessible, and universal healthcare of the highest quality. We are truly honored that he has chosen to visit our university, as well as several of our affiliated hospitals, to gain a better first-hand understanding of healthcare in Canada. Indeed, I would suggest that we see the Senator's initiative as part of an important global effort. We all stand to benefit by engaging in the rigorous comparative study of different healthcare systems and their respective strengths and weaknesses. I'm proud to say that the University of Toronto is a global leader in this effort. Our Dalla Lana School is one of the top-ranked schools of public health in the world. In its earlier incarnation as the School of Hygiene, its faculty laid the foundation for the development of universal healthcare. A former faculty member, Dr. Burns Roth, went on to become the Deputy Minister of Health in Saskatchewan, when that province adopted universal health insurance, the template for Canadian Medicare. We continue to have a strong cluster of scholars studying the quality, accessibility, and efficiency of health services across multiple faculties of the university, as well as in our affiliated hospitals, research institutes, and several other specialized groups. Senator Sanders has raised the issue of universal health care in the United States and put it on that country's national agenda with unmistakable resolve. I know we are all looking forward to hearing from him in a few minutes, but Senator Sanders, welcome to the University of Toronto. I'm now pleased to welcome the Honourable Kathleen Wynne, Premier of Ontario, and distinguished alumna of the University of Toronto. Have to get that in. Premier Wynne has dedicated her political career to building a fair, open, and diverse society. Her commitment to improving the lives of Ontarians is evident through her record of investing in education, hospitals, public transit, and infrastructure. Ladies and gentlemen, please join me in welcoming Premier Wynne back to the University of Toronto.
Thank you. Thank you, Merrick. It's wonderful to be here with all of you. Bonjour, bonjour, Annie. It is a real pleasure to be here with all of you. Senator Sanders, thank you so much for joining us, and all of your colleagues who came with you, thank you, all of you who have traveled to be here with us today. It's a great honor. And as Merrick said, Senator Sanders has become known all over the world for his tireless mission to improve healthcare for Americans. And it's wonderful and it's an honor that you chose to come here to make that comparison and to ask the tough questions, to bust some myths about what happens here in Canada and Ontario. Thank you so much for coming. So I want to also thank Dr. Danielle Martin, because she has led, yes. So, Senator Sanders told us yesterday that she's the most famous physician in the United States. We're pretty happy to claim her here as our own. So thank you, Danielle. So we did a hospital tour yesterday, and Dr. Martin led us on that. And we had an opportunity to see Senator Sanders' real passion for healthcare and for improvement. And, you know, as I said, he asked a lot of questions, and we were able to hear answers. So answers like, compared to the U.S., we here have survival rates for those diagnosed with cancer, longer life expectancy in general, and lower infant mortality here in Ontario and in Canada. Our health system achieves all of this, and at the same time, we spend about half as much as the U.S. does per capita. We take tremendous pride in that, and we hope that it serves as a beacon, further as a beacon for Americans as they consider healthcare options. But you and I know we don't have all the answers. There is always more that we can do. And so it was really refreshing and challenging to be part of conversations yesterday at the hospitals with the Senator as we examined what's working in Ontario and what more we need to do, because we need to continue to strive. And we need to do that particularly at this moment. We're in a really rapid time of change. The Senator encourages us to think bold. He pushes us to think about bold steps that we can take to build the kind of world that we want to live in. And that's exactly what we're attempting to do here in Ontario. And one example that I talked about yesterday with Senator Sanders is that we are expanding OHIP. We are expanding Medicare here in Ontario. OHIP Plus will provide free medication for young people from their birth until their 25th birthday, free prescription medication in Ontario. And that will make a huge difference for people who have seen their workplace benefits shrink or disappear altogether. For young people who are just starting out, that's an extra bit of security that will be there for you. And it's the biggest expansion of Medicare in Ontario over the course of a generation. But the other thing that Senator Sanders and I talked about was that this time of uncertainty means that we have to tackle everything. We don't just have to tackle healthcare. Healthcare is a huge part of what we can do to make sure that people have certain lives, but there are other things that we have to do. So raising the minimum wage to $15 an hour. That's right. Making college and university tuition free for hundreds of thousands of young people. Doubling the number of licensed child care spaces. All of that is necessary, and it is our plan, and it is the plan that we are implementing. So, like Senator Sanders, I believe firmly that we have a lot to learn from each other. So I want to say a heartfelt thank you to him for taking the time to visit Ontario for some very thought-provoking conversations. And I know everyone here shares my admiration for how the Senator has really channeled his own experiences growing up in a family, living paycheck to paycheck in Brooklyn, into a lifelong passion for leveling the playing field. It's what government exists to do, to make sure that people have what they need and to do the things that people can't do for themselves. That's what government exists to do. His relentless advocacy should remind us all that the strong, vibrant province that we live in today didn't happen by chance. It's not an accident. It's been very intentional, generation after generation, what we have built here. But it took people standing up, demanding better, and coming together to make that happen. When we build on that legacy and we find ways of making life in Ontario fairer, we build a stronger province for everyone. So, now let's hear from the man himself, Senator Bernie Sanders.
Thank you.
Thank you so much.
Thank you. This is a beautiful auditorium. And thank you all very much for being here. And let me thank President Gertler for inviting me. And let me thank Premier Wynne for that very, very generous introduction. In fact, she gave half of my speech, so I'm going to make it a bit shorter. And I want to thank the Dalla Lana School of Public Health at the University of Toronto, the North American Observatory on Health Systems and Policies, the Wellesley Institute, and Women's College Hospital for coming together to put this event on. I want to thank Ed Broadband and the Broadband Institute for the great work they are doing, and you'll hear from Ed in a little while. Finally, let me thank Dr. Danielle Martin, and the Premier mentioned her, who has helped not only make this event possible, but more importantly, she was kind enough to come down to Capitol Hill a little over a month ago to stand with 16 of my U.S. Senate colleagues to help us introduce what we call a Medicare for All single-payer bill, which finally will allow the United States of America to do what every other major country on earth is doing, and that is guarantee health care to all as a right, not a privilege. Now, politics is tough stuff. And there are a lot of powerful special interests who are not content to make billions of dollars in profit. There are individuals in the United States not content to be worth $50 or $100 billion. They want more and more and more. And they are prepared to step on anybody and everybody to get their way. Now, what one might think, and the Premier made the point, that we should be looking, all of us should be looking. Canadian healthcare system, not perfect. British National Health Service, not perfect. No country in the world has all of the answers and never will as technology changes, as needs change. And sensible policies, and the president of this university made the point, we look all over the world and we ask the hard questions. Is it working better there? What can we do to make our system better? Right now in the United States of America, as many of you know, we have 28 million Americans who have no health insurance, none whatsoever. We have, what you don't know, is even more than that, people who have high deductibles and high co-payments who are underinsured, which means that when they get ill, and I know it is a bit hard for Canadians to understand that, but when they get ill, they do not and cannot go to the doctor because they don't have enough money to pay for the deductibles or the co-payments. Maybe it's $50, maybe it's $30. They don't have that money. And as a result, when they get their symptom, when they're ill, they hesitate going, and they wait, and they wait, and they wait. And I have talked to too many doctors in my state of Vermont and all over this country who tell me that there are times when people walk into their offices so ill that, in fact, their situation is terminal unnecessarily. They could have been dealt with if they came in when they should have. And the truth is not widely discussed in America that we lose thousands and thousands of people every single year unnecessarily because they don't go to the doctor when they should. In terms of Dr. Martin, she came to Washington not only to help us initiate a Medicare for All program, she was there earlier, and we had her on a panel when I was chairman of a subcommittee. And one of my Republican colleagues started to do what is often done, not tell the truth about the Canadian healthcare system, or not tell the truth about systems all over the world. And he started in his line of argument. And Dr. Martin did not take those attacks lying down. She stood up, she fought back, she refuted him point by point. And 31 million people have seen that video on Facebook. And literally, not just in the United States, not just in Canada, but all over the world. So, Dr. Martin, thank you very much. Now, I'm here to talk, obviously, about health care. But I think, as the Premier indicated, when you talk about health care, you're not just talking about health care, you're talking about history, how we got to where we are today. You're talking about values, because how a society deals with healthcare is more than medicine, it's more than technology. It is about the values that those societies hold dear. In 1945, after the horrible suffering of World War II, the British Labour Party won a landslide victory in the United Kingdom. And there was a man named Nye Bevan, not all that well known around the world today. He had been, at the age of 13, a coal miner in Wales. His father was a coal miner. He dropped out of school. He went into the mines at the age of 13. And from that, he became involved in the trade union movement, became involved in the British Labour Party. And in 1945, he was named to be Minister of Health in that government, Labour government. And he said, upon assuming that position, that within 1 year, every person in the United Kingdom would have health care as a right. And on July 5th, 1948, in an historic moment for modern civilization, he cut a ribbon. The hospitals and the doctors' offices throughout the United Kingdom became available to all without any cost to the patient. And he laid out 3 principles for the national health system. 1, that it meet the needs of everyone. 2, that it be free at the point of delivery. 3, that it be based on clinical need, not ability to pay. Closer to home, and I know you know this story, here in Canada in 1947, Tommy Douglas. So I gather you know who Tommy Douglas is. He was as you all know, the Premier of Saskatchewan. And in 1947, he introduced the Saskatchewan Hospital Services Plan, the first universal hospital insurance program in North America. In 1959, he announced a Medicare plan for his province, which became law a few years later, and as you all know, became the model for the Canadian healthcare system. Saskatchewan was the first place in North America to guarantee health care to all people, regardless of their income. And that was another historic day. Now, my point about mentioning Bevan and Douglas is to point out that their work did not happen in an accident. It wasn't the case of Nye Bevan saying, you know, I kind of think it's a good idea to have health care for all. He came into office as a result of a landslide victory of the Labour Party, where working people all over Great Britain looked around them and said that human dignity demands that all people have health care. He did what the people of his country wanted him to do. And the same thing in Saskatchewan. It wasn't Tommy Douglas saying, I have a great idea. I woke up, last night, I got a dream, and this is a good idea. He was able to implement his program because his political party at that point, the Cooperative Commonwealth Federation, won 47 out of 52 seats in the Saskatchewan's legislature in 1944. Point being here that real change, and the change in the UK and the change in Saskatchewan is very real change. It never happens from the top on down. Real change always happens from the bottom on up. And as all of you know, that change never takes place easily. Frederick Douglass, the great American leader of the abolitionist movement, always reminded us that freedom is never given to you. If it's given to you, it's not real freedom. You got to struggle for it. You got to fight for it. You got to take it. And that is the history of all real change in this world. It's the history of the workers' movement, of working people working under terrible, horrendous conditions in my country, all over the world, working 60, 70 hours a week, where you had children of 10 or 11 years of age working in factories, working in the fields, where workers could be arbitrarily fired for any reason that their boss gave. And workers stood together, and they were beaten and sometimes killed, sometimes jailed, because they said, working people are entitled to basic human rights. We will have unions. We will have collective bargaining. And that is the history of the civil rights movement. I was just talking to Dr. Claudia Fagan, who came here with me from Chicago, talked about Martin Luther King's great speech, which I happened to be at during the March on Washington for Jobs and Freedom. And what people must understand about the civil rights movement in America, it wasn't just Dr. King, as great as he was, as great a leader as he was, extraordinary leader. It had been going on for 100 years from people who stood up, were beaten, were lynched, who demanded that in America we end racism. And many of those heroes and heroines, we will never know who they were. But when Lyndon Johnson, President Johnson, signed the Civil Rights Act in 1965, that was the result of people at the grassroots level for many, many decades. The same thing with the women's movement. Women fought and died 100 years ago today in the United States of America. Women did not have the right to vote. They got a divorce. They didn't have property rights. Women and their male allies said, excuse me, that is not acceptable. Women will not continue to be second-class citizens. And at the grassroots level, people stood up and fought back. And that's the history of the gay rights movement, where people, again, said, we will not be humiliated. We will not be ashamed because of our sexual orientation. We are human beings. We are human beings, and we will have the right to love whomever we want. And that is the history of the environmental movement, when very courageous people looked out around them and saw the terrible things that were happening to our environment decades and decades ago. And that is our mission today. Our mission is to have the courage to ask the questions that may not be appearing on television tonight or in the front pages of the paper. To ask the questions that take on the incredibly powerful special interests who have so much power in my country, your country, and all over the world, to ask a simple question: whether we find it acceptable that the 6 wealthiest people in the world today own as much wealth as the bottom 50% of the world's population. To ask a question which very few in my country will ask: whether it is acceptable in the United States that we have more income and wealth inequality than any major country on earth, with the top 1/10 of 1% now owning almost as much wealth as the bottom 90%, and where over 50% of all new income in the last number of years is going to the 1%. And a lot of people are uncomfortable about asking those questions, because you know you're taking on very powerful special interest. You're taking on campaign donors, people who might contribute to the university, and you kind of step back. And that night, no, I wasn't talking about, I don't know anything about this university. I know all about universities all over my country. All right? But those are the tough issues. Taking on the fossil fuel industry. And telling them that their short-term profits are not more important than the future of our planet. Way back in 1944, President Franklin Delano Roosevelt, one of our great presidents, gave a State of the Union speech which historically has received relatively little attention. And in that speech, he introduced a new concept to American politics, and a very radical concept indeed. And what he said in so many words, he said, look, we in the United States have a great Constitution, and we do, and we are very proud of that. And we have a great Bill of Rights, which says that you have freedom of speech, you have freedom of religion, you have freedom of assembly, that newspapers have a right to publish anything they want to publish. And of course, we are trying to get Donald Trump to read the Constitution of the United States, But he said, and all of that is very, very important. But then he said something else. And he said that we have come to a clear realization of the fact that true individual freedom cannot exist without economic security and independence. And then he continued, he said, among these economic rights are the right to adequate medical care and the opportunity to achieve and enjoy good health, the right to adequate protection from the economic fears of old age, sickness, accident, and unemployment, the right to a good education. All of these rights spell security, end of quote. What was he talking about? What he was saying is, of course, all of us believe in the right of freedom of speech, the right to vote for the candidate you want to vote for, the right to publish what you want to publish. That's inherent in all of our democratic societies. But he asked the question, how free are you if you are 70 years of age in the United States of America and you cannot afford the prescription drugs you need to stay alive? How free are you if you're a single mom trying to raise your kid with dignity and you're making $11 an hour? How free are you if you're one of the 28 million Americans who cannot afford to go to the doctor when you get sick because you have no health insurance? And that is a very important debate that we need to have. What does freedom mean? And to my mind, when we talk about human freedom, it's not just the right to vote, but it is the right to live in security and dignity with a decent job, decent educational opportunities. Healthcare is a right, and live in an environment which is clean and which is not being destroyed by climate change. And in the United States, 21 years after Roosevelt gave his speech, Lyndon Johnson won a landslide victory in 1964 after President Kennedy, of course, was assassinated. And in 1965, Johnson signed legislation creating what we call Medicare, which is a public health insurance program for people 65 or older. And at the same time, he signed a program called Medicaid, which provides health care to lower income people. And what is very interesting when we think about the debate going on all over the world in terms of austerity efforts, etc., is that the national health system in the UK, your Canadian healthcare system, our Medicare system remain extremely popular today. People understand a good thing when they have it. In 2004, as I think all of you know, a poll conducted by the CBC named Tommy Douglas the greatest Canadian. Now, I want to take you into what is going on politically in America and do it in a way that relatively few members of Congress will do. Because something very different and, in a sense, unprecedented is going on in the country, and it is more than just Donald Trump. What we are looking at right now is a very powerful group of billionaires led by the Koch brothers. Anybody here hear of the Koch brothers? Well, learn about them. Because there are many people, including myself, who will tell you that these two brothers, who are worth about $90 billion, are more powerful politically in the United States than either the Republican Party or the Democratic Party. And the reason for that is they have developed their own extreme right-wing political network, which not only in a given campaign cycle, and we have congressional elections every 2 years, will contribute hundreds of millions of dollars to elect right-wing candidates who represent the interest of the wealthy and the powerful. But above and beyond that, they establish think tanks, they establish chairs at universities throughout the country, they have significant influence over the media. And what is the agenda of this incredibly wealthy family? It is an agenda which says that government should play virtually no role in our lives, perhaps except for defense. That concepts like Social Security or public health or public education should be scrapped and privatized. That we should move America back to where we were in the 1920s, when working people had no protection as workers, where the elderly, the children, the sick, and the poor had virtually no rights at all. That we should go back to a society where freedom was based on the amount of money that you had in your bank account. And they are spending enormous amounts of money. They have taken the Republican Party from what used to be what we would call a center-right party to a right-wing extremist party. A party that several months ago, if you can believe it, voted to throw some 30 million Americans off of the health insurance they currently have by making massive cuts to our health insurance programs and by ending the Affordable Care Act established by Barack Obama. Fortunately, literally by one vote, we were able to beat them back on 5 separate occasions. But they are back again. And I want to tell you about the budget because this is what they stand for. This is what the Koch brothers are paying for. Now, I want you to think about it. The United States now, we have massive levels of income and wealth inequality. For 40 years, our middle class has been shrinking. We have 40 million people living in poverty at the same time as the wealthiest people are doing phenomenally well. That is the economic reality of America today. And what the Republican leadership is proposing and passed is a budget which says that we will provide over a 10-year period $1.9 trillion in tax breaks for the top 1%. It is a shame. It is a disgrace. And then they have a provision in there which would provide hundreds of billions of dollars in tax breaks to the top 0.2%, including the Koch brothers family, which would get a $30 billion tax break, not having to pay the estate tax after they died. And in that budget, they want to throw 15 million people off of health care by cutting Medicaid by $1 trillion. They want to make massive cuts to federal aid to education, to nutrition, and to needs of the elderly and the children. That is what happens when billionaires are able to buy a political party. Don't let it happen in Canada. And what that would mean if they got their way, I mean, it's almost indescribable, and I think half of you won't believe me when I tell you what, in fact, it would mean. If you throw 15 million people off of health insurance, children will die who are sick, kids with disabilities will not get the care that they need. We want, in America, to make public colleges and universities tuition free. They want to make it more difficult for our young people to get to college at a moment when the world is changing so rapidly and young people need more education. Let me just conclude my remarks by saying this. In the United States, the vast majority of the people, in fact, believe in a democratic and humane society. Right now, what we are taking on as a result of a disastrous Citizens United Supreme Court decision is a situation where billionaires are undermining our democracy and are effectively buying elections. Our job in the United States is to overturn Citizens United and establish a vibrant democracy of one person, one vote. And when we do that, we also have to be mindful of something else. And that in America today, as many of you may know, many Republican governors are working overtime to suppress the vote. We have in America one of the lowest voter turnouts of any major country on earth. Our job is to get more people to participate in the political process, and yet we have governors who are trying to make it harder for people of color, for young people, for poor people to participate. And we're going to take them on as well. Now, yesterday, we had a wonderful, wonderful trip, and I want to thank all of those responsible for our ability to go to the hospitals and meet so many great physicians and administrators. And we learned a lot about your system and the extraordinary things that your system is doing. And there's so much to be learned, and we will take back what we learned here and what we know about the Canadian healthcare system to the United States Congress and to the American people. And as the Premier mentioned a moment ago, we in the United States have got to ask a simple question. How does it happen that here in Canada, you provide health care to every man, woman, and child, and you do it at 50% of the cost that we spend on health care in the United States? And the answer is, to a significant degree, that we have a health care system not designed to provide quality care to all people in a cost-effective way, but frankly, a system designed to make billions in profit for the drug companies and the insurance companies. And the issue of the pharmaceutical industry, by the way, is not just an issue for the United States. It's an issue for you as well. Your prices in Canada, depending on, obviously, the drug, are often 50% of what they are in the United States. And many years ago, I took a bunch of people from my state of Vermont across the border, go up to Montreal to buy medicine at a fraction of the cost we were paying in Vermont. But you are also paying some of the highest prices in the world for prescription drugs. And our job is to tell the pharmaceutical industry that they cannot continue to rip off the people of the United States, Canada, or any place else while they're making unbelievably excessive profits. And there is another area where I think the United States and Canada are in the same boat, and it's not a good boat, and that is regarding dental care. I can tell you that in the United States, dental care is very, very expensive. There are many low-income people who basically, and children who cannot get to the dentist when they need. And any physician will tell you that when you talk about health care, dental care is part of health care, cannot be ignored. So let me thank all of you for being here. Thank the people who organized this visit. And thank you for the values that this province and this country are showing to the world. They mean a lot to many of us. Thank you so much.
Good morning. I'm Marilyn Emery, and I'm the President and CEO of Women's College Hospital. It is my pleasure to introduce a colleague and a friend who has played a pivotal role in improving healthcare here at home and beyond our borders. At Women's College Hospital, we are on a mission to close gaps in our healthcare system. In 2013, we founded the Women's College Hospital Institute for Health System Solutions and Virtual Care. WEAVE, as we call it, is a real-world solutions engine tackling some of the toughest challenges in our healthcare system, from wait times to access to prescription medicines and the use of technology to improve care at home and in the community. Dr. Danielle Martin has helped to lead that work, and we are so proud that her vision, policy expertise, and passion for equity have made her a leader in the debate over the future of healthcare in Canada. I hope you will all join me in welcoming Dr. Danielle Martin, a practicing family physician and Vice President at Women's College Hospital, to the stage.
Thank you, and Senator, of course, we're extremely honored to have you here with us, and we had a wonderful time yesterday, some wonderful dialogue with Canadian patients and healthcare providers about what's working in Canadian healthcare and what isn't. But of course, you knew a lot about the Canadian healthcare system before you came. In the process of drafting the Medicare for All bill, I know that you and your colleagues learned even more. I'm curious to know what surprised you yesterday. What was unexpected?
One of the things that surprised me was the degree to which both patients and physicians appreciated and understood the importance of getting money out of the care process. In other words, we talked to some patients who had very serious medical problems. Is the mic not working? Who had some very serious health problems. And what everybody knows is that when you are sick, if you're diagnosed with heart disease, you need surgery, or cancer, and you have to go through all of that difficult therapeutic process, what you want to focus on is how you get well. And I think what the patients and the doctors said is that it was of enormous importance for patients not having to worry about how they're going to pay the bill. Imagine struggling with cancer and filling out all kinds of forms and wondering what happens if you leave the hospital $50,000 in debt, and how you're going to be able to pay that. Is your family going bankrupt? Not only is that painful unto itself, it hinders your ability to recover and focus on your own needs. And doctors said the same thing. They said, we can provide the therapy and the medicine that our patients need and not worry about having to get permission from the insurance companies or having to worry about whether our patient can afford that test. So from both the doctor's point of view and the patient's point of view, understanding that the goal is to make the patient well and not have to worry about how that patient is going to be able to afford the treatment, that is just an enormous step forward in providing good medicine. That's something I learned yesterday.
So we know that, of course, the Canadian system is not perfect, but I think many Canadians, in a very polite way, take some umbrage to some of the myths that we hear propagated about Canada and the American healthcare debate. I'm wondering if you could tell us what is the most important myth to bust about the Canadian healthcare system, and what can the people in this room do to help you bring facts to that conversation?
Good question. I was on at a hearing in the Senate, and some senator said, you know, if you have health care as a right, it means that physicians are slaves. Now try to follow this logic. Stay with me. Because if I have health care as a right, I can knock on your door at 4 o'clock in the morning, and you must provide health care to me at that moment. Therefore, you are literally a slave was the word used. So my question to the American physicians who were up there on the panel was whether or not they believed they were living in slavery. You will not be surprised to know that they did not. The other issue is quality of care. Yeah, it's great to be able to provide quality of care. It's great to be able to provide health care to all people. Quality is substandard. Waiting times are interminable. People get ill, they can't get in to the doctor when they need it. And again, I think what we all know, and you know is better than anybody who wrote a book on the subject, Canadian healthcare system is not perfect. It has its problems. But I think there are just a whole lot of very intentional lies and distortions. These are not misunderstandings. These are very intentional lies in order to try to convince the American people that the current dysfunctional system we have is the best that we can do.
So, I mean, we have a room full of people here who, judging by their reactions, don't feel enslaved. I would venture to say even perhaps feel liberated from the worry that you have described about what will happen if any of us gets ill tomorrow. How can we help?
I know that Canadians are well known throughout the world as gentle and kind people. Be a little bit louder. And stand up and fight. Stand up and fight for what you have achieved and defend it. Look, I'm in politics and I get criticized every day. I'm sure the premier gets criticized every day. Nothing is perfect and people have different points of view about everything. But when you accomplish something significant, like guaranteeing health care to all people, stand up and defend that all over the world. Let me give you another example. And we're fighting for this. You know, we're making a little bit of progress. In the United States of America today, there are women who are giving birth right now, today, and they will be forced to go back to work in 4 or 5 weeks because they need the income to take care of their family. It happens all over the United States. Now here, as I understand it in Ontario or nationally, if you have a baby, you get a year's paid leave. Is that right? That is, again, an enormous accomplishment which allows a mom and a dad to bond with the baby, not force a mother to go back to work before she should. Stand up and defend that paid leave. Now, on all of these issues, raising the minimum wage to a living wage, pay equity for women, rebuilding our crumbling infrastructure, we are working hard, and in some cases, we are making good progress. But what is very important in the American debate is to have not only Canadians, but people all over the world standing up and saying health care is a right. When you have a baby, you have a right to stay home. If you work 40 hours a week, you should not live in poverty. And we need you to say those things so that those of us in the United States who are fighting these fights are not told, oh, what you're saying is it's too radical. It can't happen. We want to join you in saying, well, it is happening, actually, in countries all over the world. How radical an idea is it, for example? Something that we're pushing in the United States, I know you're pushing here. To say that in a world where technology is changing every day, where the education system must change with that technology, if we're going to be able to get the good paying new jobs that are being developed, how radical an idea is it to say that we must extend the concept of public education from first grade to 12th grade through higher education? It's not a radical idea. So we need your help. Stand up. Fight for your country to do even better, but defend with pride what you have achieved.
So I have a final question that's quite linked to that, actually, and it relates to the process of making change, because it's hard. What you are up against is hard, and I must say, even here in Canada, the changes that we need to make to improve our health and social systems feel hard to many of us at times. You know, the inclusion of prescription medications, universal pharmacare, dental care. We're all on a journey here, and the change is not easy. How do you think we're going to be able to achieve it?
The journey is not easy, and the journey never has been easy for human rights and for human dignity. And what I worry very much about, which we don't talk about for, again, obvious reasons, is that in my country and in many parts of the world, we are moving away from democracy into kleptocracy and oligarchy. And that is, in country after country, you are seeing a small handful of people control not only the economies, but also the politics of that country. And what we need to do all over the world is develop strong grassroots movement. We need to tell every person, every working person, every young people that you are sorely mistaken if you think that politics is not important to your lives, that it is absolutely imperative that you be involved. If you want a climate that is livable, you got to be involved in politics, because there are very, very powerful special interests who could care less about the planet. If you want to expand and protect what you have in healthcare or in education, there are people out there in every country in the world who think that it is more important to give tax breaks to the richest people in this country than to provide healthcare or education or economic rights for working people. And what we need to do is take those oligarchs on. That is the fight of the moment. So we can argue amongst ourselves, what is the best way forward on healthcare? What is the best way forward for the economy? What is the best way, how do we have the great universities that we want? All of that needs serious debate and discussion. But I will tell you with 100% certainty, there are people who are enormously powerful, who have more wealth than you can dream of, who could care less about your lives, about your children, about your parents. They want it all economically. They want it all politically. And we in the United States, Canada, all over this world, we have got to stand together and tell these oligarchs that this planet belongs to all of us and not just to a handful.
Good morning and bonjour. My name is Dr. Kwam Mackenzie. I'm the CEO of the Wellesley Institute. We're one of the proud co-sponsors of this event. The Wellesley Institute aims to improve health and health equity, and we do this through policy development based on the social determinants of health. My job is to introduce Ed Broadbent, who's going to give a vote of thanks. But before that, I'll take the liberty just to say that Senator Sanders and Dr. Martin, thank you for your inspiration, your leadership, and your passion. We may be divided by a border, but we're united by the common goal of wanting to think of health as a human right. And thank you for that. So 60% of what makes us sick and what keeps us ill is the social determinants of health. And social inclusion, social cohesion, proper democracy, housing, education, equality, and freedom from fear and persecution are some of the most potent preventive medicines. Ed Broadbent knows this. He's a colossus in social policy, was as an MP for 21 years, leader of the New Democratic Party for 14 years, and now is chair of the Broadbent Institute. And I'd like to invite him to give the vote of thanks.
Thank you very much, Premier Wynne, President Gertler. Fans of Bernie Sanders, I want to pick up on what Bernie said just a minute ago and say, as one Canadian Social Democrat, to all of you, I'd like you to give a very special, loud welcome to North America's leading Social Democrat, Bernie Sanders. On a personal level, Bernie, I have to say, as a guy who's somewhat older, it's a pleasure for me to see such energy coming from a much younger man. The Medicare for All campaign that Senator Sanders recently launched is critically important, and when it succeeds, will greatly improve the health, literally, of tens of millions of Americans. And I want to say that it's no accident that it is this continent's most admired progressive who is leading this campaign. One of the basic tenets of social democracy is that some rights, such as health care, are best safeguarded by being removed entirely from the vagaries and unfairness of the marketplace. As Bernie Sanders has said many times, and he repeated it here this morning, and I quote, "Health care must be recognized as a right, not a privilege." As a Canadian, I want to thank Senator Sanders for prompting much needed reflection, not only on his health care system, but on ours. He modestly titled his talk today, "What the U.S. Can Learn from Canadian Health Care." And I'm sure that there is much, as he's indicated already, that our American friends and neighbors can learn. But Canadian Medicare is now 55 years old. Today it's wildly popular with our fellow countrymen, untouchable as a basic right by any political party. But it's worth reminding ourselves that it took a considerable struggle to establish our Medicare system. Struggle, as Bernie has just said, is key to any social reform. And when Canada's first social democratic government brought in Medicare in Saskatchewan on Canada Day, appropriately enough in 1962, it was widely expected to fail. Instead, it spread across the country, becoming popular with all other political parties eventually, and became national legislation within a decade. I have no doubt that these same levels of public support will be there for Senator Sanders' groundbreaking proposal, which in many respects, I say candidly as a Canadian and with no false modesty, is superior to what we have here in Canada. Unlike our Medicare, Senator Sanders' Medicare for All plan is comprehensive. It concludes not only hospitals and physicians, which we cover, but also, and get this, and these are part of his plans for the U.S., eye care, dentistry, psychological services. And prescription drugs for all citizens. I'm sure you agree that we do indeed have much to learn from him. In that regard, I was pleased to note that last month the New Democratic Party introduced in Parliament to create a new national pharmacare program. It didn't pass, but I can tell you the struggle for it will continue. And I also want to note, and it pleases me a lot, that the man who will lead that battle, Jagmeet Singh, is with us today. Thank you, Senator, for what you have said today. Thank you for your tireless leadership on behalf of Americans. Thank you for your decades of friendship and collegiality with the people of Canada. We wish you a bon voyage.
Thank you. My name is Greg Marshall, and I'm the director of the North American Observatory on Health Systems and Policies. And my job here for the next couple of minutes is just to provide some closing remarks on behalf of the academic partners, the Dal Anna School of Public Health here at the University of Toronto. Senator, your visit here is a great example of the need for cross-border policy learning, the very reason the North American Observatory was created. A network of independent academics located in universities throughout North America, observatory scholars are conducting systematic studies on how healthcare is financed, organized, and delivered throughout the world. It focuses here in North America at both the national and, even more importantly, at the provincial and state levels where many of the critical policy decisions are made. We can only understand our similarities and our differences, and we can only evaluate and judge our innovations, our successes, and yes, our failures through systematic comparison. We use what we learn from others to question our own ways of doing things and our own assumptions and biases. Most important of all, we use comparison to catch a glimpse of what might be possible. Senator Sanders, you've received a welcome today in Canada that is normally reserved for celebrity rock stars. Bob Marley, in a song he once sang in this city, said, "In this great future, you can't forget your past." True, we never should. But nor should we treat the past and the present as a prison which determines our future. This morning, I walked past Convocation Hall at 8:30 a.m. on my way to my office. As I was walking by, I saw the future. Hundreds of young students, young people. Many of you are in here today. Unfortunately, some are outside still. All lined up to hear Senator Sanders. And it is you who are going to build this great future. To close, I thank Senator Sanders and Dr. Martin, but I also want to thank all of you because you represent that hopeful future for being here today. May I ask you to rise as you are able and remain standing at your seats for the departure of the platform party, and I thank you all for coming today.